World Cancer Day, celebrated on 4th February every year, aims to prevent millions of deaths each year by raising awareness and education about cancer and pressing governments and individuals across the world to act against cancer. Today's discussion on cervical cancer elimination, presented by The Brand Story, is brought to you by FOGSI and supported by GenWorks. To shed more light on this subject, we have with us an eminent panel today. Joining us are Dr. Hrishikesh Pai, President of FOGSI, Dr. Madhuri Patel, Secretary General of FOGSI, Dr. Priya Ganesh Kumar, Chairperson, Oncology Committee FOGSI, and Geetanjali Roy Chowdhury, a technology expert in the healthcare industry from GenWorks. First question is for Dr. Hrishikesh Pai. Dr. Pai, as the President of FOGSI, could you shed some light on FOGSI's drive towards cervical cancer elimination?
So basically, as you know, FOGSI is the custodian of women's health in India. We have been there for many years, nearly 6 decades now, and we have a membership of nearly 40,000 gynecologists all over the country. And we do a lot of programs, and one of the priority programs of our organization is prevention of cervical cancer. When I became the president of the federation, I coined a new campaign called Badlav or change, and I defined it by 3 words. That is, first word was integration or ekikaran as it is known in Hindi. The second word is samanta, that is equality or equity, and the third word is technology or takniki. And what I meant by that is that we need to integrate the care, and cervical cancer is a part of the entire gamut of things that we provide to the women of this country as far as health is concerned in this country. So Federation has got different programs going on at the same time. One of the main program is that I wanted to start what is known as the Badlav Clinic. So we have the Badlav Clinic where a woman can walk into this Badlav Clinic and get a free checkup. We also are recommending to the government, we have already had a committee, and we have recommended that HPV vaccination should be made available for every woman who is less than 15 years. Every girl between the ages of 9 to 14, 2 doses should be given. And the government is very much in favor of incorporating this in their overall national vaccination program. And we are very hopeful, the Federation is very hopeful to know that there are other important aspects of the Federation. We have Dr. Priya Ganesh Kumar, who is our Chairman of the Oncology Committee of FOGSI, who is spearheading the SSNPP program, which is a very successful program where she is training all the doctors in how to do colposcopy and how to do therapeutic treatments for women who are diagnosed with pre-cancerous conditions or cancerous conditions where they can be referred to oncologists. And we also have another program that is going on, which is there for a long time, where the Federation is carrying out the certification program on colposcopic training, which has been also going on very well, because we need to also keep on updating and training our own fraternity. Coming to the Badlav clinics, that's a grand idea that ultimately all our 40,000 members will volunteer, because I personally feel that we have taken a lot of obligation from the government. Our education has been free. You know, when I was a young budding student, my education was free, and had I not been educated free by the government, I would not have been sitting here as a doctor. So I have been obligated by the government. We are obligated to the government, and it is our duty, it is a bounden duty to pay back whatever we have learned. We need to tell, because Badlav Clinic is just one of the multiple things one can do. I personally feel that the government has gone way ahead. If you look at the medical healthcare treatment, there are 50% to 60% is taken care by the government, and around 40% they go to private clinics. The private clinics need to be more upgraded now. The government is in fact doing very well. So Federation fortunately has both private members as well as public. Many of the professors, all the are members of the Federation, the FOGSI, and so it is our duty to see that through these 2 different groups of people, our members be approached to different parts of society.
Absolutely.
And that is the advantage of the federation because it can take care of both groups in a very effective fashion.
The Nari Swasthya Jan Andolan Yatra. Could you shed some light on the same?
Yeah, I mean, we undertook this yatra and we covered 21 cities. So I started from Rishikesh on the 28th of November.
Okay.
And we went to the 5 states of Uttarakhand, Uttar Pradesh, Bihar, Jharkhand and West Bengal, and literally covered 21 cities, and we had a fantastic experience. We did a public forum in every city. We had a health checkup camp. It was a holistic integrated approach where besides other things like anemia, blood pressure, BMI, other history, we also focused on looking at cancer. We did health checkup, we did first speculum examination, visual examination, we did pap smears, and we reached nearly 60 million people. Promoted besides other aspects of health, we also promoted the concept of prevention of cervical cancer, not only cervical but other cancers like breast and oral cancers as well.
May the love for your patients and your society give you more power and energize you to go and take even more steps going forward. All the best, Dr. Bai. Thank you. Dr. Madhuri, as the Secretary General of FOGSI, what are the different FOGSI capacity building programs and training initiatives for cancer elimination?
Thank you, Ivan, for the excellent question. Before I reply to your question, I would like to talk about FOGSI. Of course, Dr. Rishikesh Pai has talked about FOGSI, but I would like to go in detail about it. FOGSI is prestigious, most vibrant and one of the largest OBGY professional organization of the world, with 266 member bodies and 39,500 plus members committed to women's health. FOGSI, one of the mission is elimination of cervical cancer, and we are working towards it. FOGSI has two wings, that is academic wings. One is Indian College of Obstetricians and Gynaecologists, commonly known as ICOG, and second is Journal of Obstetrics and Gynaecology of India, that is known as JOGI. In ICOG, that is in our college, we have fellowship programs as well as certificate courses, and journal is our bi-monthly issue. So there are 6 issues in a year. It is in a digital format as well as printed form. The idea of printed form is that they are distributed all over India to our 39,500 plus members free of cost. The idea is that people, the members who are not digital savvy or who are at the remote places where the internet is the issue, they can go through the journal because we have editorial, we have review articles, we have research papers as well as we have case discussion. So they can go through that journal and they can update their knowledge and they can implement in their practice to improve the quality of women's life. FOGSI has been conducting various hands-on certificate courses for improving the skill of the member and updating the knowledge of the member, and colposcopy is one of such courses. Colposcopy and biopsy play a very important role in diagnosis of precancerous lesion and treatment of it. FOGSI has been conducting these courses since last 18 years and have trained more than 1400 members in this colposcopy training program. There are total 21 centers all over India which are FOGSI accredited training centers. Now, these trained doctors are now empowered with the knowledge to perform colposcopy, colposcopy guided biopsy, diagnosis and treatment of the precancerous lesion in remotest areas. These capacity building training programs are the true asset to cervical cancer elimination drive. So dear friends, let us join hands to make our women aware about this disease and make the India cervical cancer mukta. At the same time, we can also eliminate mortality due to cervical cancer as well as suffering of women due to cervical cancer. This will not only help our family but also the society and the nation to move forward. Thank you very much for giving me this opportunity.
Thank you so much, Dr. Madhuri Patel. Dr. Priya Ganesh Kumar, as an expert in the field of cervical health, could you shed some light on the WHO Global Elimination Goal, and also what are the efforts you have taken as a committee chair of FOGSI?
WHO has come up with a fantastic elimination goal, that is cervical cancer elimination by 2030. Now what does that mean? It is given one mantra of 90-70-90. That is 90% of girls under the age of 15, that is from 9 to 14 years, being vaccinated with HPV vaccination. Because cervical cancer is caused by a virus called human papilloma virus, and since it is affected by virus, there is a vaccine available for that. 70% of the women from the age of 30 to 65 years to be screened at least twice in a lifetime with HPV testing. It's a high performance test with HPV testing, at least at 35 years and 45 years. And those who are screened positives, they get 90% of them who are screened positives then get treated for the precancerous and the cancerous conditions. Now the best part for the cervical cancer is that it is preceded 10 to 15 years by a stage called a precancerous stage, which is absolutely symptomless. It can be only detected by doing a screening. If this elimination drive becomes successful, it is said that there will be less than 4 per 100,000 women would be affected by cancer at any given point of time by cervical cancer. As of now, India, what we are seeing in the Globocon 2020, cervical cancer is the second leading cause of death due to cancers in the women, and it is accounting to 18.3% of all the female cancers. The first being breast cancers and the second being cervical cancer. So this elimination drive done successfully would have less than 4 per 100,000 women affected with cancers. Now, as a committee chair of FOGSI for Oncology Committee, knowing the fact that it cannot be one-sided, we have to have a multi-pronged approach. So we did come up with 3 mantras of sensitizing the public regarding this vaccination, regarding the need and awareness about cervical cancer, pre-cancer, and the screening, which is very, very important. The second mantra being sensitizing and doing a capacity building for the clinicians. And again, the third was sensitizing the public figures and the policy makers. So we did a survey, came up with these strategies. We had done a survey for public, and almost pan-India had taken part, with 70 gynecologists taking the part of the survey. The survey was a very simple survey. We wanted to know the awareness amongst the public. So, and also the screening, past screening taken up by the public. So what we found was the awareness was very minimum. What was our projection? We were to come up with some IEC material and with AV, audio video IEC material. We wanted to test them initially, even before we took it up into FOGSI. We brought it in 8 different languages, and various women were, then once we came to know about their initial status, then we ran these AV videos, and then we again took up the survey to understand how many of them have really now come forward for taking us, getting themselves screened and getting their children vaccinated. So there was a fantastic, the results was initially the ladies would have been aware by only 18.1% say,
Okay.
and the awareness after hearing this AV videos rose to 84%, and many of this 84% of the ladies then came forward for getting themselves screened and to get the children vaccinated, girls vaccinated. Yeah, so that was one part, one mantra. The second mantra was the SSNPP drive. Now the whole thing comes under the project called as Swasth Sundar Nari, Prevent the Preventable. We never wanted to say, cancer, because this word is very obnoxious. People don't want to hear cancer.
Huge negative connotation.
Yeah, so we want to go through a positive approach. And the positive approach is, say that girl, the lady looks sundar, swasth, sundar, nari. So when you have a swasth sundar nari, when you do the prevent the preventable. Now what's preventable? Cervical cancer. Because cervical cancer is the only cancer which can be prevented.
Okay.
So then with the capacity building of the, for the clinicians, we did again a survey to understand what was the ground reality of the clinicians in this subject. All right. And then when we did this, then we came up with a fantastic, webinar series. A module was created for, making them aware and making them for their capacity building. And FOGSI has around 267 societies.
Okay.
And through this efforts of skill development and capacity building for our FOGSians, we went across having around 25 webinars, covering almost 200 societies.
Okay.
And again, this was during the COVID era as well. So we weren't going around because it was a lockdown. And from there on, we started doing this hands-on workshop for colposcopy, because colposcopy is, it's a device, it's a tool for identifying the screen positives, whether they do have any precancerous lesions. So this is a workshop which we are conducting it pan-India, and I'll be very happy to share with you, Ivan, that we have done almost 25, hands-on workshops for our FOGSians, and almost more than 20,000 FOGSians have been benefited. Whenever we have been going there, we have invited the policy makers, might be a health minister or the the public figure out there, an MLA or the minister,
Okay.
or a commissioner, whoever is the policy makers. They have been invited for such as a guest of honor, and then they are primed regarding the vaccination, regarding the screening, and that's how these three mantras have together brought up a real good change, and I'm very happy with this happenings.
Thank you for such a detailed outlining of the initiatives that you've taken, and thank you so much for that very comprehensive answer, Dr. Priya. Thank you so much. I now move on to Geetanjali Roy Chowdhury. Geetanjali, thank you for joining us. As a healthcare technology company focusing on affordable access and connected care, how can you help to eliminate cervical cancer by 2030?
We've heard from our experts that cervical cancer is the second most cancer affecting women. At the same time, cervical cancer is the only cancer that can be prevented if detected early.
Okay.
Cervical cancer elimination can happen only by adopting mass screening, and that too closer to where our women live. But at the same time, it cannot happen in isolation. It has to be tech-enabled, wherein we bring in complete end-to-end solution, right from screening to diagnostics and treatment at point of care. Our devices are cloud connected, which enables clinicians to have remote access of all the procedures that's happening at the site. Genworks is the first femtech company that brings in together best-in-class technology for cervical cancer elimination.
Okay.
Our AI-enabled devices that are supposed to be used by trained paramedics are connected care devices. We also bring in point-of-care affordable solutions for treatment, which will help our clinicians to achieve the mission of cervical cancer eradication.
Wonderful. Thanks for that wonderful overview, Geetanjali. May I ask you, how is the technology supporting the gynecological fraternity to solve the eradication of cervical cancer?
We've been working with gynecology fraternity for last 2 decades to significantly reduce maternal mortality by bringing in best-in-class ultrasound technology. We've been working closely with FOGSI for over past 2 decades. And we've significantly reduced maternal mortality by bringing in best-in-class ultrasound technology. And now we are working closely with FOGSI in their mission of eradication of cervical cancer. In this direction, we have closely worked to develop the SSNP app, which has the screening guidelines by FOGSI. We are doing mass screening across the country under the guidance and support of Dr. Rishikesh Bhai. And we are extensively focusing on developing collaterals and awareness with the FOGSI Committee of Oncology to create awareness among the clinicians. And we continue to bring in international best practices in the field of cervical cancer elimination.
Gitanjali, you talked about technology and you also talked about point of care earlier. May I ask you then, does AI and connected care have a role given the challenges of availability of specialists at point of care?
Absolutely. Point of care devices that are AI enabled plays a significant role in enabling tech and specialist access in low resource setting, and it plays a very important role in mass screening. Our mission is to impact affordable access, and we leverage the best-in-class technology in femtech to enable our gynecologists to deliver this mission.
Wonderful. Thanks for outlining all the initiatives that you've taken in association with the gynecological fraternity. Thank you, Gitanjali. I hope today's discussion was useful in highlighting the need for early detection and elimination of cervical cancer. And I am sure with the efforts of FOGSI, various doctors, healthcare companies and technology partners, the mission and vision of achieving the elimination of cervical cancer by 2030 can be achieved. On behalf of the brand Story, this is Ivan Rodrigues signing off. Take care.